And I was also thinking during this, did you find it was hard to get over like the hierarchical barriers? Like if nurses feel like they can speak up versus other specialty doctors during some of these trauma calls?
I think being in the MD position, often we're afforded like, and we don't necessarily, we're somewhat ignorant to that, um, because traditionally the hierarchy in medicine is that the physician is sort of like the lead of whatever these are. I think we've realized the importance of that being, that concept being disrupted. Um, and the notion and the idea of what you're getting at, I think, is this idea of psychological safety where people feel empowered to speak up. A lot of work by Amy Edmondson, who sort of, I guess, coined and popularized that term, but really has made it like you should do everything possible to have a psychologically safe space. And I don't think you just achieve psychological safety. I think it's a sort of a thing that you are trying to have occur. It's not like it's binary that you have or do not have a psychologically safe environment, but it's this idea that a team member feels that they can speak up without fear of retribution, and that if they see something concerning, that they can alert the team, they can flag it, they can, whether they give the feedback in the best way or not, it doesn't matter, but they can say things that they are seeing that raises concern, or obviously positive feedback as well, but tends not to be such a problem. And so if either they're identifying a problem within the recess, identifying a problem with another team member, identifying something that critical desaturation, that's not anybody's fault per se. That's just something that's happening. But we certainly have heard many stories in healthcare of spaces, environments, teams that likely don't have that psychological safety. The story of Elaine Bromley, uh, which some of your listeners might be familiar with, is a woman. Her husband was a pilot and has kind of made famous her story, unfortunate story, where she died in a routine OR in the UK, where the nurses identified that this patient was not being able to be intubated, and the crite kit was just outside the room, and unfortunately the anesthesia team kept trying to intubate from above, and eventually, I think they then tried to wake her up, and she had a significant hypoxic event, and unfortunately died. But that's a great example, an unfortunate example, and a tragic one, but one that Martin Bromley has used to try and create, and really push forward this idea of the importance of teamwork, the importance of team performance, the importance of a psychologically safe environment, and figuring out ways in which we can speak up and feel empowered to speak up without fear of retribution. And I think we should, think about our culture, figure out ways in which people can, feel empowered to do so, because ultimately, I think Google studied this. What are the ways in which teams are most successful, and psychological safety was the number one identified common theme or factor in sort of predicting team performance. And so Google's interested in this because it's going to lead directly to better products and ultimately profits. And I think this likely is no different in the tech space than it is in the healthcare space.
So if you find this work valuable, the simplest way is to support the podcast by subscribing and sharing it with someone who'd benefit. And I want to recognize and acknowledge Casper, which is the Canadian Ambulance Service, Paramedicine, and EMS research repository. It's a free, open access platform making paramedicine and EMS research more visible, usable, accessible, and operational across Canada. So a huge credit goes out to Dr. Alan Batt and the team for leading the work and advancing open science in EMS. This podcast is for educational and informational purposes only. It is not medical advice, does not establish a standard of care, and must not be used to diagnose, treat, or manage any medical condition or emergency. The content discussed reflects general principles that may not apply to every situation, system, or patient. Clinical practice varies by region, service, and jurisdiction. Always follow your local medical directives, clinical guidelines, protocols, and the instruction of your medical oversight or base hospital physician. The host, guests, and producers make no representation, guarantees, or warranties regarding the accuracy, applicability, or completeness of the information shared. The views expressed are those of the individuals and do not necessarily reflect those of their employer, regulatory bodies, or medical oversight authorities. By listening, you acknowledge that the host and guests assume no responsibility or liability for any actions taken or not taken based on the content of this podcast. This material is intended solely as a supplemental educational tools to support ongoing professional development, not a substitute for accredited training, certification, or authorized clinical guidelines.